Hello, everyone. My name is Hyunjae Kwon, and I'm a second-year PhD student at the University of Minnesota's Sociology Department, and also a second-year trainee at the Minnesota Population Center. Today, I will present our poster titled Meso and Micro-Level Structural Sexism and Mental Health, Comparing Women and Men in Different Gender Couples, made by myself, Claire Camp-Dush, Ann Meyer, and Wendy Manning. I'll first start the presentation with a brief background of our research topic. It is widely known that mental health is highly gendered and that women tend to have poor mental health. Studies have highlighted the importance of individual factors in explaining gender differences in mental health. However, feminist scholars have long argued that gender should be conceptualized as a multi-level system of stratification consisting of institutional, interactional, and individual levels. In the current research, we examined how meso and micro-level measures of structural sexism affected women and men's mental health, specifically loneliness, depressive symptoms, and generalized anxiety. We used survey data from the National Couples Health and Time Study, which is a nationally representative study of cohabiting and married individuals ages 20 to 60 in the United States. The data originally consisted of 1,515 primary respondents who also had their partners complete the survey. Limiting the sample to only individuals in different gender couples and primary respondents who also had their partners complete the survey resulted in the final sample size of 968. Our independent variables consisted of both micro and meso-level measures of structural sexism. For the micro-level measure, we used the respondents' perception about the safety of their living area for women. Responses ranged from 1, which indicated not a good place, to 5, which indicated a good place. Our set of meso-level structural sexism measures included log ratio of the men's to women's annual income, combination of men's to women's educational attainment, and the ratio of men's to women's age. Our dependent variables were measures of mental health. First measure was loneliness, which was continuous and consisted of 3 items that were added up. Second measures was depressive symptoms, which we aggregated 10 items to create a single continuous variable. Our last measure was generalized anxiety. We summed up 7 different items. As you can see by the alpha values, they were all high, indicating that the individual items were closely related. Now I move on to the table on the bottom right of this poster to show which structural sexism measures had a significant effect on the different types of mental health measures. You can see that the neighborhood safety for women had significant effects for all 3 measures of mental health, indicated by the 3 stars, which symbolizes p-value less than 0.001. So the safer the respondents perceived their area to be for women, the lower the level of loneliness, depression, and anxiety for both women and men. Next, you can see that the ratio of ages was significant for women's loneliness, which means that the older the men compared to the women, the more loneliness women reported. Lastly, relative educational attainment was significant for women's generalized anxiety. The reference level was the women earned more than the men. So among men, having the same educational attainment as their partner was associated with higher levels of anxiety compared to when their partner had higher educational attainment. In conclusion, the micro-level structural sexism was not only harmful for women's, but also for men's mental health. Some of the meso-level structural sexism mattered, such as age ratio and relative educational attainment, but others did not. We plan to expand our set of meso-level measures in the future to better understand the effect of meso-level structural sexism and mental health. The main finding of our analysis is that creating healthy relationships and safe spaces for women is essential for improving both women and men's mental health. Thank you for listening to my presentation.